Now, Iranian authorities have rejected a report in the BBC's Persian service which claims the Ministry of Health underreported the number of coronavirus deaths. Data sent to the BBC by an anonymous source claims the death rate in Iran is triple official figures. The number of COVID-19 infections in the country are also higher, coming in at under 500,000. For more, we can go across to France 24's international affairs editor and host of Middle East Matters, Sanam Shantyaei. Sanam, what is the state of the pandemic in Iran?
Delano, the BBC has indeed published this very important and interesting report, but when it comes to reporting on numbers coming out of countries like Iran, where there has been a real lack of transparency from the beginning of the pandemic, we do need to be more cautious. So it would have been great to see some of that data claiming, as you said, that 450,000 people or thereabouts have been infected. Now, let's delve into the crisis itself. Undoubtedly, this is Iran's second wave. There are reports from the Ministry of Health itself that some 26 out of 31 provinces are in the, quote, red zone. Now, there was a dip in the middle of April. Why the spike? There are a plethora of reasons. One of them is that the country's leadership wanted to avoid at all costs the shutdown of an already battered economy. Now, there are protocols like wearing face masks, like social distancing, but they're not being implemented. And lastly, what we refer to as super spreader events like religious ceremonies, like weddings, they're not actually being banned. Now, when it comes to numbers themselves, it's the Iranian capital, Tehran, that has suffered the highest number of deaths. But proportionally, the city of Qom is the worst hit. That's, of course, the clerical heart and establishment of the Islamic Republic, and that's where the first cases of COVID-19 were initially detected back in January. And what's really interesting is that a disproportionate number of those dying are foreign nationals. And in a country like Iran, that can only mean one thing, that it's migrants, it's refugees, predominantly from neighboring Afghanistan. Now, as a result of everything that I've just mentioned, and this is very rare to happen, officials inside the country are actually criticizing Iran's mismanagement, saying we want less slogans and we need more action.
Now, Sanam, you've spoken to a doctor working inside the country. They did not want their identity revealed. What kind of picture did he paint?
I spoke to a doctor earlier this Monday who works for a private clinic, which is some 40 kilometers outside Tehran, the capital. And based on his own experience and the conversation he's having with others in the medical health profession, he's saying he's estimating that the numbers could potentially be, and this is in line with the BBC report, up to 3 times higher than what we're actually seeing. And the numbers that he was providing were really startling. He's saying that on average, his clinic is receiving 150 patients over the period of 24 hours. 100 of them are showing symptoms linked to COVID-19. However, only one is being tested and testing positive. Why is that? One of the reasons that Iran has a real shortage of tests because of the lack of connection that it has with the international community. And on top of that, the prices of these tests are extremely high. And unless you're someone that belongs to a vulnerable category, for instance, a pregnant woman, the state doesn't assume the costs. We're talking about 450,000 toman per test. That's equivalent to 17 euros. You have to have several tests to ensure accuracy, to make sure the recovery period is dealt with. And so if you're having 2 or 3 tests, for someone who's earning a minimum wage salary, which is under 100 euros a month, that's almost 50% of your salary. So even you and I, if we were in that position, we wouldn't be doing these tests. On top of this, there's no official network that's linking these clinics to the Ministry of Health. So the numbers aren't being provided nor recorded. And lastly, this is something that I very briefly alluded to earlier. Whilst there are protocols, they're not obligatory. There are no fines issued if they're not being distanced. Observed even. So if you happen to walk into a cafe, a restaurant, a bank, or public transport, you will see a number of people that aren't observing any of those protocols. As a result of this, this doctor told me that they are expecting a 3rd wave in autumn, and there's not a great deal that people can do. They can't afford not to go to work.
Sanam, thank you very much for that. Sanam Shantyaei there working from home.